Thank you for listening to Clear Answers About Clear Vision, the exclusive podcast by Vance Thompson Vision. We hope this episode has empowered you to take the next step toward achieving clear vision. If you found this information helpful, please share it with a friend who might benefit too. Ready to take the next step? Schedule an evaluation with our expert team or visit us online at vancethompsonvision.com to learn more. Together, we'll help you see the world more clearly, one decision at a time. Until next time, take care and keep your vision worth seeing.
Hey everyone, I'm Deborah Stvitt. I'm an oculoplastic glaucoma and cataract surgeon from Vance Thompson Vision in Alexandria, Minnesota.
Beautiful. And I'm Dr. Zach Keenum. I'm an oculoplastic surgeon in Sioux Falls, South Dakota. And today we're going to be doing a podcast episode that'll be about 30 minutes. And we're going to go over kind of a few of the basics around oculoplastic surgery. We'll talk about what oculoplastic surgery is, when patients typically will consider it. We'll go through kind of what the consult looks like. So if you're going to see your oculoplastic surgeon, what to expect at the consult. And then the third thing we'll cover is kind of the recovery and aftercare that goes into the whole process after surgery. So before we jump into it, though, anything new and exciting with you, Deb, in the world of oculoplastics or otherwise?
We're about to launch a study that I'm super excited about. Technology is always evolving and changing. And I know, Zach, you get excited about that too. Oculoplastics is such a unique field, and we'll talk about what it is. But we're trying to do things like cataract surgery or glaucoma surgery in more of a minimally invasive fashion. And so it's kind of fun that we have some new techniques that are evolving that include possible sutureless techniques for upper eyelid skin removal, as well as evolution of laser skin rejuvenation that really just gives patients more of a youthful look. You do such a beautiful job, Zach, in, addressing the uppers and the lowers, and also, the whole face and making it, just art and beautiful. And so it's just kind of fun to have some of those new technologies evolving.
Exactly. And it's always evolving, and especially even in the world of lower blepharoplasty, trying to make that less and less invasive, in the same way we are for the upper blepharoplasty with that new device and that new study that we're looking to start doing.
Yeah, and
So
I think it's so cool, when you talk about oculoplastics, a lot of people are like, what is that? They don't even know that, some of the surgeries we can do are more functional. So people can lose vision actually from redundant eyelid skin of the upper eyelid or hooding of the upper eyelid. And so when I think about oculoplastics, it really starts with, kind of aging. When we're in our 30s, our bony structure starts to change. We lose fat in our face. We lose muscle. So it kind of atrophies or it gets weaker over time. And then the skin loses elasticity. We lose collagen over time. So all of these things create almost like a downward, kind of effect where we don't have the elevation we used to. And that's a lot of the reason why we see some of the issues that we do is because, over time, things change anatomically.
yes, I agree. I mean, aging really is the story of descent and deflation. So a lot of the rejuvenating surgeries we do are kind of reversing those two things. We're pulling things back up and we're adding volume back a lot of times to try to kind of give a more youthful appearance. And like you said, help patients, regain their functional ability to see better. Like you said, it's something that can really affect vision, and patients often don't realize that it comes on because it comes on so slowly. So a lot of your cataract patients probably tell you after they've had surgery that, oh my God, I didn't even realize like how horrible my vision was until you fix it. And we find that with oculoplastics too, that they often don't realize the slow onset and descent of their eyelids and brow. And so it makes a big difference after the fact.
Yeah, and I just think it's amazing how, people don't realize how much they're working to keep those eyelids out of the way. We'll ask about headaches even, and they're like, "Oh yeah, I have tension headaches all the time." And then you see them, really trying to pull their brows up. And so that, creates more tension around this area because you're using your frontalis muscle more. And so with that, we can also see issues of dry eye and eyelid strain because they're not blinking as much because they're trying to look beyond their eyelids. Or we can see, the lower lids start to, kind of turn outwards a little bit as, again, that descent happens. And so, not only are we, lifting to where it should be anatomically, but also we're really trying to protect the eye and restore vision just as much as we are in other specialties of ophthalmology.
Yeah. And so that was what I was going to ask you first, is kind of just to give a breakdown of what oculoplastic surgery is, for our general population that may be listening here. Oculoplastics is probably not a super familiar subspecialty of medicine. So Deb, will you just kind of break it down in very simple layman's terms as to what it is we do on a day-to-day basis? You've already hit on a lot of it, but um, just for the listeners.
Yeah, we talked about what happens with aging and, being eye care specialists, we focus on, the eye, but the eye is more complex than you think. It's a beautiful structure from the front of the eye to the back of the eye. But what happens around the eye? That's a huge part of what we do and what we need to address to make sure that, patients feel more refreshed and rejuvenated, as well as restoring eyesight in the periphery, as well as protecting the globe. So eye plastics, meaning, we're addressing the anatomy around the globe, involves a lot of things to not only help lift and elevate, but also restore that anatomical function to help with how patients produce tears and where those tears drain to. It includes, things like, even medical conditions that we're looking for, like thyroid eye disease that can affect the eye. We're looking towards things around the globe, the anatomical structures such as the lacrimal gland that produce tears that can also have an effect on a medical diagnosis such as lymphoma or different tumors that we see. As well as looking at eyelid lesions. And so a lot of times, if we don't look around the eye, we'll miss it. And so we're going beyond the globe itself and we're addressing the structures around. The eyelid is very complex. There's multiple layers and there's multiple muscles that involve the structure or the function of the anatomy, such as lid closure and lid elevation that we're looking at as well.
Right. So we're essentially plastic surgeons for this area. So do you think it's important, Deb, to, when patients are considering getting plastic surgery in this area, what benefit is it that we bring with our ophthalmology training? Because we were trained as ophthalmologists first and then went on to do further subspecialized training in plastic surgery in this area. Do you think it's important that we have that baseline eye training and ophthalmology training when we're working in that space?
I really do. Plastic surgeons are wonderful. And, you see some facial plastic surgeons that do brilliant work. But when it comes down to the eye specifically, it's amazing how many things you can catch medically by looking. And so that's where our training comes into play when we're looking for underlying disease processes that can maybe cause droopy eyelids or disease processes that can make the eye protrude a little bit more. So we're constantly looking at the entire structure of the eye. And so, what I'm thankful for is that we've been trained to look at the surface. We're looking at, the dryness of the cornea before we do anything to make sure that we're not going to create a new problem. We're looking at, different muscles in the eye that move. And because we have more knowledge of of the globe itself, that can come into play with what we're seeing structurally in this region. And then looking at the back of the eye, it's amazing what you can see when it comes to actually directly looking at blood vessels to the optic nerve and that structure, making sure that looks nice and healthy and that we're not missing anything further that's creating the appearance of the external disease process.
You've touched on this a lot already, but kind of just go over like maybe your top three most common oculoplastic surgeries that we do on a day-to-day basis, and then if you'll tell us what your favorite one to do is and why.
So definitely what I see as a comprehensive doctor is upper eyelid skin hooding. That's the number one surgery that I do when it comes to oculoplastic surgery. So what that means is we're removing the redundant eyelid skin and closing it through a very elegant zip stitch procedure that basically takes about a week or so to recover, and then we remove that long stitch that has so elegantly brought the skin together. So that's called a blepharoplasty. In addition to that, the second procedure I probably do the most are lid lesion removals, actually. And we can do those in the office as well as in the operating room. But it is very, very important, especially, with patients that have had sun exposure throughout their life, those who have noticed that there's a little lesion that's growing and changing, that needs to be addressed, because just as much as you can see skin cancer, you can also have different processes like basal cell or squamous cell that develop on the eyelid margin itself. And so we're constantly evaluating lid lesions to make sure, number one, we're keeping the patient safe, as well as determining, the risk of cancer. So that's probably number two. And then number three is kind of a mixed bag for me. There's not a day that goes by that I'm not addressing redundant eyelid skin plus something else, whether it's, the brows are coming down where they need to be stabilized, or the lids are starting to turn out because they're so lax, so we're tightening those, or the muscle is a little bit more droopy and that needs to be elevated as well. And so a lot of times with even upper eyelid skin, we're addressing other things at the same time in a minimally invasive fashion. Part of my passion right now in oculoplastics is truly skin rejuvenation and addressing the lower lid crepiness as well as the redundant eyelid skin. And so I just think that this, kind of carries forward that beautiful, refreshed, restored look that patients are going for. How about you, Zach?
Yeah, I think it's very similar. So definitely the upper blepharoplasty, which I want to say is maybe the third most common plastic surgery in all of plastic surgery after I think it's liposuction and maybe breast augmentation and then upper blepharoplasty. But certainly for us as oculoplastic surgeons, upper blepharoplasty is number one. And then probably number two for me is probably ptosis. I do a ton of ptosis combined with, like you said, we pair these surgeries. So often we'll take off some upper eyelid skin, that's the blepharoplasty. And then we're also often raising the eyelid to make it more open and take away some of that droopiness. And that's something that often takes a little bit of counseling with patients. They don't always understand that that's two separate surgeries. It's a lifting surgery where we're tightening the muscle of the eyelid, but also removing some of the redundant skin. That's probably number one and two. And then number three is probably brow for us. We do a lot of brow work, and we've done that a lot of different ways. I actually just did one about an hour ago. We did a little brow pexy with the cosmetic upper blepharoplasty. But I've actually started doing a lot of very small direct brow lifts, even in women, hiding that right above the eyebrows here. Really gets them out of needing like a full endoscopic forehead lift, a big, huge forehead lifting surgery. So we're doing very small little direct brows for just this amount of lift. And we've done a lot of different closure techniques in the way we suture. I've done the running subcuticular, that zip stitch, like you talked about with monocryl, which works well. But what we've settled on lately is doing actually horizontal mattresses for that. And that's been super nice. They heal beautifully. So we're able to give a lot of our women actually this little just this little lift to the tail of the lateral brow here, with very minimal recovery needed and very little um, uh, like surgery in terms of the invasiveness of the surgery. We're not down on bone. We're not pulling the entire forehead up to do this. So that's been really nice. But those are probably our biggest three. And then my favorite's probably going to be, like you said, the lower blepharoplasty, treating the under eye skin. And one thing we've actually started doing in that regard is we've started doing fat grafting. So we're borrowing fat from the abdomen, we're moving it up into this area, and that has a two-part effect. One thing that it does is it allows us to add volume in this tear trough hollow, the zygomatic hollow, the lateral orbital hollow here. So we build up the cheek at the same time that we reduce the puffy under eye bags. But what it also does is it brings stem cells that actually rejuvenate the skin, like you were talking about. And so those stem cells actually help with skin quality and texture. And something that I'm hoping we're going to start doing here soon is actually microneedling some of that skin, some of that fat into the skin at the end of our surgeries. So actually, we emulsify that fat. So we make it very thin so that it's almost like a slushy consistency to add volume. And then we go one level more fine. So it's almost a liquid. And then we're going to start microneedling that into the skin to really help with skin quality, texture, and the dark under eye circles. So
I
I'm
love
right there
that
with you.
because like when you talk about like what people notice, at least in my practice, patients notice the under eye bags and the jowls. And maybe, wrinkles around the mouth. Like those are the three things that I feel like I get the most like, hey, what would you like to, see look better? And those are the three things. And so eyes are super important when it comes to, addressing things. And, Zach, I don't know about you, but, people ask all the time, okay, you and I love, doing lower lids and we're constantly learning. I learned so much from you as far as how to rejuvenate kind of the mid volume or the mid face volume loss. And we can do that through fillers. Those will last around 9 to 12 months. And sometimes, longer depending. But what you're trying to do is actually restore and rejuvenate with, stem cells, which I think is so fascinating. And again, we would all like to do things in more minimally invasive ways. And so, I just like, I love where you're going, as far as continuing to push the bar as, to we're not going after this, old facelift look anymore. People want to look natural and they want to look rejuvenated. And you're discovering ways to do that, which is so neat.
Yeah, it's a lot of fun, and it's something we're trying to get right. And like you were saying about these deep lines, a lot of patients, to really pull these nasolabial folds, these deep lines here and these marionette lines around the result from the jowling. Without patients don't always want a facelift to treat those. And one of the nice things about this fat grafting technique is we can put it right there at the time of the lower blepharoplasty. So while we're building up the cheek a little bit, we can fill this area, we can fill this area. But yeah, it's been a lot of fun trying to kind of do that for patients. And one of the beautiful things, that I wasn't expecting us to be able to do was to be able to do it on patients while they're awake in a pretty comfortable way. So we're doing this under twilight sedation in a very minimally invasive way. Tiny little poke hole incision. We harvest a very small amount of fat and then place it with a tiny little poke hole incision with a needle that doesn't need to be sutured. So it's been a really nice minimally invasive technique that we're trying to get to be really good. Okay, so let's kind of dive into what the patients should expect. So maybe they're aware of what oculoplastics is, they have an idea of what we can offer them, so they decided to make a consult. They're going to come see us. What should they expect when they come to see us?
Yeah, number one, we want to make sure that, we can really evaluate the whole entire face as well as the eye. Being eye surgeons, the eye structure is so important. Vision is so important. And so a typical exam will involve testing to test how well they're seeing out in the periphery. with their eyelids taped up and with their eyelids in normal anatomical position. And so if you're really struggling with seeing to the side because of your eyelids, we can actually prove that. So, if it's more than 30% loss of vision, we can actually prove that this is medically necessary. So it's more of a functional upper lid blepharoplasty. And that goes along with, ptosis as well, where the muscle is drooping. We're evaluating, number one, the top third, the middle third, and the bottom third. And so we look at, where the brow height is. We look at, where the kind of skin under the brow to the lash line lies. We're looking at the lid crease as well as where the lid is falling when we're looking at the reflex coming back to us from the cornea to say, okay, is the lid anatomically where it should be? We're pulling down on the lower lids to see how lax they are and if they're in normal position. And then we're looking at, again, the mid face to make sure that there's, no scarring that would cause, some issues that we see in oculoplastics, as well as looking at the skin structure to make sure that we're evaluating for skin cancer, as well as addressing other things like vascularity, sunspots, wrinkles, and whatnot. And then we're looking at the lower face to make sure that we balance, what we're doing and what we're planning. So again, it really goes back to, doing the test, the visual field, the side vision test. We take pictures, and so those pictures really help us to see how much the lids are interfering. We do a slit lamp exam, so we look at the eye itself to look for dryness and for any other pathology. And then, also we look towards the skin quality itself.
Yeah, and so one thing I've noticed that patients are very appreciative of in these exams is, how that's a lot of stuff we're doing and how quickly we're able to do it, and kind of get them back on their way back to their, normal day-to-day in their life. For us, it's probably, when patients arrive, we get them in pretty quickly. We go right back to the visual field. Maybe that takes 10, maybe 15 minutes to do that visual field testing to prove to their insurance whether or not, it should be covered. Then we get them back to a room. We take some photos of them again for insurance and also for before photos. And another few minutes for that. And then we're in the room kind of going over everything with them, telling them what we see. I show patients in the mirror. I show them on their, a picture of them, show them what I'm seeing, ask them. The main thing is figuring out what it is that bothers them, because sometimes what I think is going to bother them is not what bothers them. So making sure we're on the same page and
Right.
that we're explicitly saying what we think we can fix and making sure their expectations are reasonable and that we think we can achieve them. And then after that, kind of explaining to them the whole process of surgery, what the recovery is going to look like, which we'll get into here in just a second. And then making sure they don't have any questions. And if not, we get them going. And it's pretty efficient process. And patients are pretty surprised by, how quickly we can get through all that and answer all their questions.
And I think a lot of it too is, patients don't realize how complex the face is. And so I love being able to show them what we can expect with surgery, because again, this isn't correcting some of the things that may bother them. So I love, Zach, how you're, talking to them about what are your bothersome areas, what would you like to see look better? So you're really, identifying, what they want. And I think that's the biggest thing with oculoplastic surgery is making sure that we align with our goals.
Exactly. Well, let's get into the recovery and kind of the aftercare. So we've done the consult. The surgery we can talk about a little bit, but that's going to vary pretty widely. We normally do it either in clinic or in an operating room, more commonly in the operating room. Well, let's touch on that pretty briefly, and then we'll jump into the aftercare. So maybe what does the surgery day kind of look like for a patient?
So depending on, what we're doing, we can do these procedures in the clinic and in the operating room. Why we do them in the operating room for some of these longer cases especially is because, patients really enjoy having some sedation on board when we do numb up the skin around the eye. And so that part can feel a little, irritating. You can have burning sensation. You can have some pain associated with the numbing process. And so I think for me, when I think about patient experience all around, number one, we want to make sure that they feel well taken care of from the time they call in through the whole process. And so, after we educate them on what we will be doing, a nurse likes to call the patient prior to their arrival time to make sure that they understand what time to come, what's expected, if they need to be NPO or nothing by mouth for, so many hours, we explain that to them. If they need to be off their blood thinners, we also explain that to them and for how long. And so we're looking at the medical history as well as, the complexity of the surgery to make those determinations. And so we really like to give patients that information before they come into the door. On the day of the surgery, patients can keep on their own clothes, and we usually give them a warming blanket because our rooms can be a little bit more frigid, and we get them nice and relaxed. We then come into the bay and we mark the eyelid. And so that means that we're making little marks with a sterile marking pen as far as, where we want to put the incision, how much skin we want to take, and we're kind of drawing a map as far as what procedure we're going to be doing that day. Once they're all tucked in and ready to go, if we're in the operating room, they come back to the operating room. We give them a little bit of sedation, either IV or they've already had sedation by a melt. That's what's, called the twilight sedation method. And then we numb up the eyelid skin and then start our surgery. And so that's the typical kind of day.
And one of the things that I think gets lost a little bit in translation sometimes is that patients sometimes will kind of have a reaction when we tell them they're going to be awake for surgery. They want to be completely asleep. But a lot of patients, once we actually are in the OR doing the surgery, they really, really, I think, appreciate that twilight sedation where we're not having to put a tube all the way down that's breathing for them. They don't have a machine breathing for them. They're not completely paralyzed during the surgery. So, being able to do a lot of these surgeries not completely asleep is actually very nice for patients. Doing that twilight sedation is actually pretty good.
Yeah, and you and I have talked about that. We all come from different training programs. And so, in a lot of institutions, patients are put out completely for more, kind of bigger cases. But what I've found is really, the medication that we have now that really has a short half-life, meaning it gets out of your system more quickly without, the effects of, these longer medications that take longer to wear off with general. Patients are kind of appreciative that they can come home and not have to go through a long recovery process sedation wise, and they really tolerate it well.
They really do. I just did a cosmetic upper blepharoplasty in clinic before we jumped on this podcast. And, patients tend to just sleep through it a lot of times. They'll wake up, talk to me, but a lot of times they just go right back to sleep. So it's pretty comfortable process. And I think we've got it down pretty well.
And what I love too, Zach, is you're doing it sterilely, regardless of whether you're in the clinic or you're in the operating room. So safety first, we're always looking at, underlying medical conditions. We're always prepared to be able to address things that come up, but also we're prepping the eye sterilely, whether you're in the clinic or in the surgery center, to, prevent infection and to make sure that, we're maintaining that nice, technique as well. So that's why it's really kind of fun to be able to bounce back and forth depending on what the patient wants. I've had some patients that don't want any IV or oral sedation. They would rather just do topical. And so I do it in the clinic. And so they can, recover a lot quicker and, not have to, go through the, coming out of sedation either.
Exactly. Well, let's talk about the recovery. So they've had surgery. Let's run through the first maybe week and then even past that a little bit. But that first week is probably the most critical, especially the first few days.
Yeah. So it's interesting because, the first few hours you're still going to be numb. And so patients come home and they actually look pretty good. We really try to control bleeding during surgery. The eyelids are very vascular, and that can be worrisome to some patients when they have some oozing or some, kind of bloody tears, we call them. And so that's totally normal to have, some oozing after surgery. But, it's really not till day 2 and 3 that you start to swell more. That's why we use different, techniques like icing as much as they can the first few days to really minimize that swelling and bruising. We also can use more homeopathic remedies called arnica. It's an oral tablet that diminishes some of the inflammatory process that we see with healing and diminishes bruising along the course. And then by day 5 is really when they start to make the turn. It's amazing how, even if we add, multiple surgeries, skin laser, it's always around day 5 that the body just kicks in and you start to notice less swelling, less redness, and more healing. Everyone's going to be different. And so we say, give it 1 to 2 weeks for bruising, especially to subside. And then when we come in at a week, we're looking at how patients are healing. And because the eyelid skin is so thin, we're really not waiting more than around anywhere from 5 days to 10 days to remove those sutures. And so regardless of kind of the procedure on the eyelid, that's kind of the magic mark for eyelid skin to remove sutures is around a week on average. And so once they have those sutures removed, we tell them that they can use scar recovery gel if they would like, but it's amazing how these scars are so well hidden that by a year, I have to really look to find them. So that's what we try to do too, is really hide and minimize the scars.
Sorry. Yeah, and back to your point about the zip stitch, the way you and I close those incisions, which is you actually showed me your technique, or Leash did, who you trained. But so I switched to using that technique. I used to close it a little bit differently, and it's just beautiful. It heals really well. So we do that on essentially everybody. And like you said, the scars become basically invisible. But I essentially tell people, like you said, it's going to be about a week where you should take it easy, mostly to reduce the chance of bleeding. Again, there can be a little bit, but we don't want any deeper bleeding in the eye socket. So we have patients take it pretty easy to reduce chances of that, reduce any chance of, an incision trying to open up. But I let patients go back to their normal life after we get those stitches out around, day 6, day 7, something like that. They just kind of ease back into normal life after that. And then, like you said, a couple weeks of bruising and swelling. And, I think patients are often surprised by how little bruising and swelling there are in some cases. Some patients certainly will bruise and swell quite a bit, but especially if they'll ice pretty aggressively and put a little pressure on it, I feel like they bruise and swell a bit less, and they tend to be pretty surprised by how little there can be. All right. Well, I think that kind of takes us through the whole process of it. We talked about what oculoplastics is. We looked at the consult, the surgery, the recovery. I don't know, Deb, anything else you wanted to add about all of this?
No, there's one thing that you touched on, though, and mentioned how we're always learning. And that's what I love about oculoplastic surgery is there's so many different techniques out there. You taught me the horizontal mattress suture technique for the upper eyelid or mid forehead and upper brow. And it is just beautiful how that skin comes together. I'm just so much more pleased with the scarring. It's a lot less. And so we're always encouraging one another to try new techniques. And, how oculoplastic surgery is evolving is really exciting. And it's just nice to bring awareness to the general population because a lot of people don't know that this is possible and that this is an option for them or even where to get started. So it's been really fun.
Yeah, I guess we'll see you guys in the next one. Thanks, Deb.
Thanks, Zach.
Welcome to Clear Answers About Clear Vision, the exclusive podcast series by Vance Thompson Vision. Our goal is to empower you with the knowledge and insights to make informed decisions about your eye care. Whether you're exploring options for vision correction, cataract surgery, myopia control, or oculoplastics, We're here to guide you. This podcast is dedicated to helping you achieve clear vision, one episode at a time.